Mr. Jackson and I first met in March of 2015 when I was consulted in the hospital for a suspicion of leukemia that was found when he was admitted to the hospital. He was indeed diagnosed with acute myeloid leukemia at that time and subsequently underwent chemotherapy for his disease. More recently, Mr. Jackson developed a cough and suspicion of infection, and unfortunately was another affected individual by the COVID-19 pandemic. With the incorporation of telemedicine, I was able to speak to Mr. Jackson on a daily basis, not only to discuss tolerance of the treatment for his COVID-19 infection, but also to assess the potential benefits that he was experiencing from the ongoing therapy. This was done on a daily basis that we were able to touch base with, and without the incorporation of technology, there would have been no way to assess his ongoing benefits and also to assess the potential risks and side effects that he was getting from the therapy.
It's unbelievable amount of confidence that you gain by knowing that you can be in immediate contact with someone. When you're in a situation with question about your heart and what the medications are doing, to be able to run it 2 or 3 times a day, send them to him, and he'll look at it maybe only once a day, but it gives him a full report. And it take him 5 minutes to just make a comment back. You keep going, everything's fine, or let's change this, whatever it might be. It's eliminated a lot of the fear that I would have normally had.
The fact of the matter is that the physical examination has been replaced by a lot of more technologically advanced processes and tests than the old stethoscope. I really thought that we would lose some intimacy that happens between a patient and physician when it comes to that one-on-one meeting. And I have to tell you that it's not lost. The patient being able to stay in their own home and in their own environment appear to be very comfortable in speaking. They don't seem to hold back anything that I would otherwise get in a one-on-one encounter with a patient. We're able to get a lot more than what we originally thought we could get from video or audio conferencing.
I was at such high risk. For me to be able to stay at home instead of go to the hospital and subject myself to greater risk was way overcame any skepticism as to whether or not I should be doing this. We all need to learn how to accept the benefits of the new technologies that are arising every day. With it comes a lot of more freedom and comfort in medical treatments and care.